Hello there and welcome. Welcome back to our Friday Facebook Lives. My name is Julie Hirschberg. I am the founder, the owner of Re+active Therapy and Wellness here in the Los Angeles area. We are an integrated practice of physical therapy, occupational therapy, psychology, wellness professionals that provide a collaborative approach to help the whole person when they have a neurologic disorder. We also provide a lot of education and training to therapists, and that is something we're really passionate about. And why I hop on here every Friday is to share a little bit about what we're learning and doing with the rest of the therapy world. I also know a lot of people with neurologic disorders also watch these videos. So the content, the things I share are really based on information that other therapists have asked me about, and I've been reading about, and I have found that a lot of the people I work with, a lot of people with neurologic disorders, are so well educated and so well versed in a lot of these topics. They can dive right into these videos as well. So wherever you are, whatever your background, thanks for joining me today. And I really wanted to thank the community that is around Re+active. Really over, gosh, we've been doing these videos for several years now, but over the last couple of months, this community has been really supportive for me. If you're just joining us, maybe you didn't know that I lost my mom a couple months ago. And it's just been a really strange time to go through the holidays and things like that. And I've been really supported by our community and energized too by the people that join me here every week. So I just wanted to thank you for that. I think it's really helping me to have a community. And honestly, the the grief and the loss of my mom is even part of my current obsession with the nervous system. As always, I'm just so curious and always wanting to understand things better. It's actually a trait that I got from my mom. Thank you, Mom. And I talk about this part of the nervous system a lot. Excuse me for a second. Just needed a sip of water there. It's the autonomic nervous system. And, especially for me over the last couple of months where I am feeling a lot more emotionally, and maybe more anxious, more stressed with what just has been kind of the upheaval in our lives. And there are so many close connections of those systems, our emotional world, with the autonomic nervous system. And today, what I we could talk forever about how some of those systems are so interconnected. Today, what I really wanted to talk about is how we screen as therapists, how we screen the autonomic nervous system. And this really comes out of a question that I had in our Brain Bites group. So our Brain Bites group is an education community of therapists who I adore. And I got to meet with two of the Brain Bites members, just the three of us. It was phenomenal. It was one of our bonus mentor sessions. We got to do a little mentor session and learn from each other. And we were talking about autonomic testing and screening. And I was like, oh, yeah, let's dive into this a little bit more. And so I've been doing a lot of reading in the autonomic nervous system, a lot of learning myself over the last 3 years. So I just wanted to share this autonomic screening 101, the basics of how we screen and test autonomic nervous system function in practice. So this is not, excuse me, this is not all of the diagnostic testing that might be done medically in autonomic disorder. So that's not what I'm talking about. That's not what I do. That is what I collaborate with a person's medical team to do. But I really wanted to touch on what, as a therapist, we could do to screen and test and then communicate with the medical teams. Why I love being part of an integrated team to have that communication, to have that back and forth. So, how do we do this? And just like many other things that we do, we start with the listening piece. Listening so important. Listening for clues of autonomic dysfunction. Now, some of these things may have come up in the person's screening. So there's a couple of scales that I like. One of them is the Compass 31. And if you're on our newsletter, I'll put a link in for the Compass 31. The Compass 31 is a screening questionnaire of autonomic dysfunction, whether that's GI dysfunction, whether it's like sweat, pupils, vision, all pieces impacted by the autonomic nervous system. So the Compass 31 does a really great job of screening those things. And so I like to have a person do that screening. It's become a part of, for integrated programs, when people join those programs, we have a series of questionnaires. The Compass 31 is one of those. And I'll also follow up and ask for questions. So when I'm listening to the story, I'll hear some things like visual sensitivity. I might hear that there's a sense of feeling like numbness, that they can't feel their body. Maybe they fainted, maybe they passed out, maybe they get lightheaded. These are all clues in the story. Some of these things also come up in a questionnaire that we've also started using that I really like, and it's called the SHUT D, and that stands for Shutdown Disassociation Scale. It's kind of set up like a semi-structured interview with questions like, have you fainted? Have you been passing out? Have you like gotten dizzy and blacked out? Have you felt like maybe you couldn't hear for a while, or that people sounded far away? Have you been able, like, have you experienced not being able to see things clearly? And again, if you're on our newsletter, I'll send you a link to it where you can see the whole scale. I really like that one as well. It's called the Shut D scale. So those both two scales and questions with those that help tune into autonomic nervous system dysfunction. Some of the other pieces too, as I alluded to at the beginning of my obsession with the autonomic nervous system, some of it could be how that person's experienced the world, that they feel a little on edge, a sense of danger and fear. Those also could be part of the autonomic nervous system. So that's the first step, listening to the story. Now, there's quite a few things that we can do within our neurologic exam to screen this. One of the simple pieces is part of our normal neuro screen, and that's looking at the pupillary response. So how our pupil reacts to light is partially controlled by the autonomic nervous system. And so what the resting state of the pupil is, how quickly it responds to light, all of those things can be looked at. They can be measured as well. So I've mentioned this app before. It's called the Reflex Pro app. This is a way of doing pupillometry to measure pupil size and responsiveness. Again, I'll put a link in our newsletter. By the way, if you're not on our email list already, we have an email list for healthcare providers. You can sign up at reactiveeducation.com, and we have a summary email that goes out every Friday with our videos and research links and all of the good stuff that we talk about all week, geared towards healthcare professionals. If you're a person with a neurologic disorder, you can sign up on reactivept.com. Videos go out, and more neurologic specific resources and links, if you have a neurologic disorder. Those also go out on Monday. So So pupillary size and responsiveness, pupillometry. One way within our screening that we can screen for autonomic nervous system involvement. Heart rate variability. This has been like all over the news, super popular right now of looking into. And I was just talking to someone also this week, also from our Brain Bites group, about, well, what does this like even mean? What do you look for? Now, we use a portable EKG device called the Leaf to look at heart rate variability. But so I'm going to give you the account of what do we look at with an EKG. This also, like my Apple Watch, for example, measures heart rate variability, not quite as accurate as a portable EKG. Some other monitors do as well. You can use a polar heart rate monitor, other things that are quite reliable as well. So the Leaf is not the only way. That's just the way that we've been using normally. But here's what I explained when I chatted with our Brain Bites group this week, our small little mentor group, is typically when we breathe. So if we take a deep breath in, normally our pulse rate, our heart rate is going to actually increase. And then when we breathe out, it goes down. And there's like a wave of this happening. It can be very rhythmic. And this is called your respiratory sinus arrhythmia. So we see this rhythm. And in in fancy ways that they measure this, they can actually measure how variable this is. And you can actually see a really wide bell-shaped curve. And when you have a portable EKG, you can actually see this. And this analyzes heart rate variability. So the heart rate variability is really a measure of the variation in time between each heartbeat, and it is controlled by the autonomic nervous system. So what I kind of think of with heart rate variability is it gives us this little like window into the autonomic nervous system. It gives us a window to look at what is actually going on. It's not the whole picture, but definitely a piece of the puzzle. So generally speaking, there are some norms of heart rate variability based on age and gender. But it's also influenced by so many things. Did you have a cup of coffee? What time of the day is it? Where are you in your menstrual cycle? It's really influenced by a lot of things. So what we use it for is, what is your heart rate variability now at this moment? And can we change it? Does it respond to breath? How does it look when you're moving and exercising? And that's what we really look to change. And take somebody, get their baseline, and then look for them to increase. That's where we want to be. We want to increase heart rate variability. So we get a baseline and then we just look to increase it. So that is how we're using it. I'd love to hear from other healthcare professionals how you're using it as well. But I love it as a screen. It's been really, really helpful for us, for our team, and we're doing it more and more. So measuring heart rate variability. The second, and I think this is one of the most common things that therapists think about with autonomics, is how does a person's blood pressure and heart rate respond with changes in position? One of the first things people think about is orthostatic hypotension, that blood pressure drops upon standing and that person feels faint and lightheaded. And yes, so this is one of the reasons why every single person that comes through the door of Re+active, we do a sitting and standing blood pressure with, so that we can look at how their blood pressure changes and heart rate changes with changes in position. But there's more. And earlier this week, I hopped on our Instagram feed to talk about the active stand test as a screening tool in to screen for autonomic function. So really briefly, basically in the active stand test, we go beyond just sitting and standing blood pressure. We do supine, lying after 5 minutes of lying, immediately upon sitting, or I'm sorry, then taking it immediately upon standing, and then 2 minutes and 5 minutes and 10 minutes. And we can look at the blood pressure and heart rate response in those different positions. We can screen, now we can't diagnose, but we can screen for POTS. We would see that that person has sustained tachycardia or increased heart rate after standing. And that's greater than 30 beats per minute. It's greater than 40 for those younger people, um without, so it's that sustained tachycardic without the person having a drop in blood pressure, so without that orthostatic hypotension. We see a lot of people in our practice that do have orthostatic hypotension, which is that sustained decrease, so greater than 20 in systolic blood pressure after standing, you occurring between a minute and 3 minutes after standing. So we can use the active stand test to look and screen for both of those conditions. And the thing is, they're treatable, and there's even things that we can do in therapy to help with orthostatic hypotension and with POTS, so that people can get and stay involved in their lives and their function to the highest degree. Uh, by the way, there's a really great article that just came out a couple of years ago looking at the active stand test. It provides a practical guide and interpretation. And I will put a link to that article. There's another resource as well. All of this I've done a lot of autonomic research and reading lately, so I'm going to put all of those in our newsletter that comes out today, or on Monday. Okay, a couple more pieces. Just this week, I was working with one of our therapists who's working with somebody in one of our integrated programs who's having some difficulty sustaining exercise and sustaining activity because of symptoms. And so we did a exercise test. I love using the Buffalo concussion treadmill test or modifying it for a recumbent bike. It's really helpful to see what the exertion level, what the heart rate, what the blood pressure is, where that person starts to have symptoms, so that we could prescribe very specific exercise for them. So we look not only at symptoms during that test, but then also at recovery. So we want to look at how does the heart rate recover after graded exercise. And again, this is another common way to screen autonomic activity. Does it stay really high? Does it come down really nicely? And that will tell us really their ability to, and a person's ability to be comfortably between those sympathetic and parasympathetic states. Because when we exercise, we are naturally going into more sympathetic activity, and then that should gradually come down during a recovery point, and you'd have more parasympathetic activity, and we should see the heart rate also decline. So I've got a great resource for that, looking at heart rate exercise and heart rate recovery with exercise. So I'll put that link in there. So as you see, there's a lot of links, a lot of resources coming out in our newsletter this week, because there's so much good stuff in the autonomic screening world. And honestly, if you would have asked me even like 4 or 5 years ago, I wasn't doing these things, or just doing one of them. And I have found, as we do, let's screen vital signs. Let's look at somebody's heart rate variability. Let's look at their breathing. As we add on the layers of autonomic screening, we get a much more rich picture, and it also directs us precisely to where we can intervene. It's so powerful. So I'm sure next year there will be even more that we know about this. In fact, Brittany Charlet, our concussion program director, and I, we work really closely with UCLA, and we're working on a little autonomic working group because this team is doing research in that realm, but also wants to make it really clinically applicable. So I'm sure we're going to learn more, and I will keep coming on here every week to share with you what we are learning and doing. So in the meantime, join our email list. Again, if you're a healthcare provider, reactiveeducation.com. If you're a person with a neurologic disorder, reactivept.com. We'll send out all the links for today from today and the videos from this week, all in one newsletter, really easy to use. You can file it away with autonomic things for when this all comes up, so that you have the tools to help the patient in front of you when they come. So I want to thank you again. Thank you again for being part of this community. Thanks for tuning in live and for catching these videos afterwards. And I hope you have a wonderful weekend. Thanks again.